Here we see the skin landmarks that we have to consider when making a medial knee approach for the postero-medial corner. Through this wide longitudinal incision, we were able to easily expose the distal insertion of the hamstrings, semitendinous and gracilis tendons. We don't usually see them as clearly as this when making a mini-invasive proximal tibia approach for the harvesting of these tendons in the ACL reconstruction, but in this case it's really easy to expose them and to harvest the semitendinous tendon that we'll use to reconstruct our medial collateral ligament. It's easy to see the distal insertion on the tibia of the medial collateral ligament, as well to palpate the joint line and the medial femoral epicondyle, where we'll have to locate the proximal insertion of the medial collateral ligament. To access the postero-medial corner is needed a wider exposure and a blunt dissection of the postero-medial soft tissues, as we aim to reach the adductor tubercle on the postero-medial aspect of the distal femur. Once we've located it, we'll be able to make a little breach through the fascia and to easily palpate the postero-medial corner of the distal femur and to go through this breach and locate the medial femoral epicondyle. The proximal insertion of the medial collateral ligament adjusts slightly posterior and proximal to the medial femoral epicondyle, as we'll see in the following steps of our MCL reconstruction.